I've always loved surgery. I love the patients. My name is Elissa Dalton, and I'm a breast surgeon at Mainline Health. So I treat a spectrum of breast diseases, anything from benign to malignant breast disease, and a spectrum of patients from young to old, whether it's someone who has a current problem or may develop a problem in the future, meaning screening for patients who are at high risk for developing a breast cancer or who have a current breast concern. So Mainline Health has a genetic counseling department, and it's often that we identify a genetic mutation for a patient that can predispose them to developing a breast cancer over their lifetime. We make a plan together for what we should be doing moving forward, and that can include things like intensive screening with breast MRIs. It can also include prophylactic surgery, and sometimes it also includes medical prevention. I do surgeries, but I also do in-office procedures for a variety of breast issues. I offer a variety of surgical procedures, including lumpectomy. We do those usually wire-free localizations. I offer hidden scar surgeries, mastectomies, which can include nipple-sparing mastectomies or skin-sparing mastectomies. Oftentimes when we catch breast cancer early, and even sometimes in later stages, we can frequently offer to our patients lumpectomies or mastectomies, and they have equivalent outcomes, and they are both safe. One of the things that makes our breast practice at Mainline Health special is that we, as surgeons, see our patients before they have a breast biopsy. And that allows us to establish a relationship with our patients ahead of time, and then I'm able to be the one calling them with the results, and we can put a plan in place right then and there. But after we meet in the office, I present their information at our multidisciplinary breast panel. We have a whole team that you inherit when you meet with me that you don't know about quite yet, and we review every new breast cancer diagnosis, and we make sure that we have a comprehensive and perfect treatment plan for that patient. We work very closely with nurse navigators for our cancer patients, and our nurse navigators are invaluable. They provide guidance, they provide scheduling assistance, they provide perioperative management for the patients, and they're always there as a point of contact to get a hold of anyone else in the system. We work very closely with plastic surgeons. There are some surgeries that I do on my own, but there are also times when I engage with a plastic surgeon who can perform a procedure maybe for symmetry on the other side that doesn't have cancer. Or if we're doing mastectomies, we really work together to make a plan for that patient if they are interested in cosmetic reconstruction. I think the patient's voice is the most important voice in the room. Ultimately, I have to be able to offer the best care to the patient, but they need to be the one who says, this is really what is right for me. Understanding where a patient's coming from, what is important to their life, that's really what I want to know about my patients, and I want to get them there. The thing that I love about being a surgeon is that I get to make an immediate impact in my patient's disease. I go into the operating room that morning, I remove their breast cancer, and after that, it's gone. And to have long-term relationships with those patients afterwards is very rewarding to me.